obesity. There's legal advice and support for a targeted bylaw that would protect the public from the harms of secondhand smoke through provisions that limit smoking in high density or confined spaces, and denormalisation of smoking through provisions that limit smoking.
Excuse me, can you move forward to the microphone, please? It's very quiet on the
Sorry about that.
recording.
Yep. Denormalisation of smoking through provisions that limit smoking in areas frequented by children and young people. In the same way that New Zealand's introduction of smoke-free indoor areas was groundbreaking internationally, but is now becoming the norm, the first targeted bylaw of this type would be seminal for tobacco control around New Zealand. Making this first step will be a considerable value in itself. A targeted bylaw will also strengthen the tools Council already has the ability to use. As the tabled report notes, Council's existing policy has considerable sector support and represents a positive commitment from Council towards smoke-free Auckland. Your existing systems such as commercial arrangement, leases, grants and licensing conditions for street trading events could already strengthen Council smoke-free policies through a directive from yourselves. However, based on advice from all government legal service, Claro Legal, which also provided advice to Cancer Society, the effectiveness of these arrangements, particularly the licensing of events and outdoor dining, would be strengthened and complemented through the provision of a targeted bylaw. So a targeted bylaw would actually strengthen your own ability to influence your outcomes. And lastly, Council is not alone in its commitment to a smoke-free Auckland. AFS and other agencies are all working towards this goal. However, a targeted bylaw would add considerable support to our existing regulatory enforcement and public health actions that's underway or proposed. At present, under the Smoke-Free Environments Act, AFS opportunities for enforcement are currently strongest in licensed premises. On the other hand, enforcement for non-licensed premises has been proven more difficult to progress. We believe that a targeted bylaw could go a long way to strengthen our ability to support the Ministry of Health in effective enforcement and to further enable prosecution for persistent breaches of the Act. Council would also be able to support AFS and other stakeholders in the sector through graduated enforcement responses such as warning notices and the use of the bylaw itself as a deterrent even without prosecution. So a targeted bylaw, we believe, could be developed to complement and strengthen existing regulatory systems. So to conclude, we believe that the introduction of a targeted bylaw focused on high density, confined areas and areas frequented by children would be considerable value on its own. It would strengthen Council's existing policies and be considerable help to Council's regulatory partners and the rest of the sector towards a smoke-free Tamaki Makaurau. This is why we consider the investigation of the targeted bylaw as a necessary requirement to complement any improvements or revisions that you make to your policy. Thank you for your time.
Thank you. Any questions? I just got one question for Dr. Sinclair. You know, this kind of a bylaw of this nature, we've got bylaws in relation to alcohol areas where alcohol is not permitted. I just wonder if Ministry of Health or the DHBs, your organisation, would consider being a partner with Auckland Council to any extent in this.
Oh, certainly. I think this is one of the things we've been involved with a number of your bylaw revisions over the last year as well. So that, and there's a lot of potential areas for interchange and working together on that. It's certainly a great option. Yeah.
Yeah, and one of the areas obviously is always funding. Maybe,
good segue, man.
Well, maybe
It's always a good thing. Well, we were looking in. Definitely. Well, we have staff who are involved in the enforcement of the certainly in licensed premises. So there's a lot of experience and knowledge that we have around that, which I'm very sure we'll be able to share. I can't commit to funding. That's Dean's area, but it's a sort of a facilitating. This will be something we'd be certainly interested in doing.
Yeah, it would be helpful if it was a joined up from your organisation and this organisation. So we'll take that on board. Councillor Walker.
Just picking up on the concept of funding, but also collaboration. I don't doubt that there are other councils around New Zealand that may be moving towards a bylaw around smoke-free, and it might be quite useful if our council collaborated with a number of them. That might, on the one hand, reduce some of our costs, but also make it more pervasive.
Okay.
So I just put that to you, Mr. Chair.
Well, okay. Well, the submitters is really the people that can answer the questions, but I think that's probably a.
So are there other councils that are moving towards bylaws?
Well, the Wanganui District
Wanganui
Council
Region.
does
Read
have
report.
a small bylaw. I'm not aware, I haven't been involved in that. Dean will know more about that implementation. It's a cautious step, I think, that they've taken in that.
Palmerston North and Wanganui.
And Palmerston North?
Palmerston North and Wanganui.
Right.
And
So that's-
LGNZ have passed a remit at conference.
Okay, well, that's good.
Lot of
That's good
leadership
progress.
down there.
Yeah. And each will have these will take a number of years to explore through and how they work and what the pros and cons are and what you get better traction on. Yeah, so certainly it's a...
It's actually anyway.
Councillor Darby.
I'd just like to move vote of thanks to Dr Sinclair and Mr
I'll
Adams.
second that.
Okay, second by
I
Councillor.
had a
Thank you. Oh, let's go, Councillor Fletcher, do you have a question?
Yes, I did have a question.
Yeah, thank you. Sorry, well, before we put the motion, you can ask.
Thank you, David. Thank you, Dean. A very comprehensive overview. Later in the agenda, we're looking at the provision of open space in Auckland and the funding around that. What you didn't comment in your presentation was how important open space is for those who want to quit the smoking addiction,
Yes.
from a health perspective.
I definitely agree. Thank you for the question. Ian Potter used to be the Chief Executive for Health Sponsorship Council, and he used to talk about the path from home to work and back again, and how many opportunities where you're promoted to take up smoking. So as Zoe talked earlier about denormalising and reducing the opportunities where you're prompted to smoking, be able to enjoy being outside. We have a lot of discussions and feedback through our cessation service where people are going to the hospital for often lung or respiratory illnesses, and they have to walk through smokers while they're trying to quit themselves, while they're supporting family. And so that exposure, both the harms of passive smoking or secondhand smoke, but also the triggers while you're already under stress or going through life. So the more we denormalise and make smoking the rare occurrence that we see, the more actually we help support smokers to quit, reduce the harm to people who don't smoke. It's all to a positive health benefit.
And there's also the aspect of activity in open spaces as being quite an adjunct to people's efforts to quit as well. It's quite a useful adjunct to that as well. Yeah.
I was giving you the opportunity to advocate for 2 agenda items. Thank you.
Thank you.
Thanks for that.
Well, thank
Very happy
you.
to do that.
Appreciate your coming in this morning, and the item will come up pretty quickly.
Thank you very much.
After the next presentation. So I'll put the motion. Those in favour?
Aye.
Against, declare that carried. We now move to item 6, local board input, and we have a presentation from the Mangere